Okay, thank you very much. I don't want to hold you up too long. And it's not easy to come up with concluding remarks after concluding remarks and after concluding remarks. So it makes it quite complicated, I must say. I think it might have been better to have kind of immediate reaction to some of the points that came up, in particular on the point of leadership that Herman mentioned, or strategic thinking, or strategic planning. I think strategic thinking, that is not a problem. I think many of us have that in their DNA, or at least in their job description. But at the end of the day, I think we should also not forget that leadership requires also decision making. And that is perhaps one of the points that need to be sorted out. It comes with plans, and it comes also with implementation. I wanted to make that point at the end, but I make it at the beginning now. And that is not just about funding or about staff or about resource or infrastructures. It is really about personality. That is something, at least I would say, from my personal observation during the COVID-19 response, and also a couple of years before working in the area of health preparedness at the EU level in the European Commission. So it is really, you need to have somebody who is taking decisions on who is not just out of the blue or based on kind of gut feelings, but very often on the basis of a kind of 70-30 basis of evidence, or of no evidence, but a good level of potential and confidence, than to move on. Because, I mean, there's nothing worse than being stuck in decision-making. And I think if we start talking about one day about strategic plans and their implementation, we should keep that in mind. So democracy is fine, but I mean, in certain situations, somebody needs to take a decision. That is my very basic readout. Let me just come to a couple of points. I mean, we heard already that we should not always look back in the past. What does it tell us? But I'm a big fan of lessons learned reports. Simply because I cannot sleep during the night, I start reading these things. And what I realized is that, I mean, you read lessons learned from SARS 2003, from H1N1, I mean, then from the financial crisis and so on. It's a big mishmash, but at the end of the day, it always comes back to the same kind of lessons learned. And we have seen SARS 2003, H1N1, MERS, Ebola, Zika, COVID, and all of these crises, pandemics, outbreaks, epidemics, were directly affecting us in Europe. No? Sometimes it looks as if it's very far away, but it is not at the end of the day, because the spillover, that is the real problem that we will also be facing in the future. So what have we really learned out of these lessons learned reports and discussions? And I mean, that meeting here is again one of these elements. I think it is very much essential to implement response measures in a way as they are planned. But I mean, not just on paper, but what Professor van Damme was mentioning, you have to test it, you know, so whatever it is not just about having full-fledged tabletop exercise or dry runs. You can also go into certain elements that simply cover essential functions. You can test it, and you can also test it in scenarios which are highly unlikely, just to trigger a little bit the participants. We also heard yesterday also from Minister van den Broeke that pandemics is not just a health issue. Very true. It has large implications on social programs, on internal and external policies, and all of this is extremely costly, not just on the spot, but also in the long run. We have to embed a response into our healthcare structures that should not lack capacities. And that is not solved yet. I mean, we have seen it massively across Europe in many countries. This point of healthcare resilience is very much essential, but it's not solved, and we really need more investments into infrastructures here. It's also absolutely essential to have early detection monitoring not just by state-of-the-art surveillance systems, but also using these systems to come up with good models that give us a prediction, or at least a kind of an estimation of what might be happening in the future. Eamon, you mentioned a good talk by Christian yesterday on what is happening. I would like to know what the next pandemic is, to go back home and to start working with the colleagues in HERA and the colleagues across the Commission and other EU institutions on this. Cross-border collaboration is very much important. I mean, in Europe, we have a legal basis for that. We very often tend to forget that we already had a legal base for cross-border collaboration on preparedness and response to cross-border health threats, as we call it, before the pandemic. But, I mean, what we saw was a large level of, let's say, under-preparedness or under-readiness. We should discuss the nuances here, I would say. But at the end of the day, what does it mean? It means that PPE was not present in the very first meeting between the member states on the 9th of January. On the 15th of January, sorry. We asked, that was the very first question we asked. Is PPE available or not? You know, you can read it in the minutes, the answer. And yeah, I mean, reality was different than what we heard there. So just as one example, it is really not just having, let's say, a legal base on paper, but really working on the structures, on decision-making, and on the investments that need to be done across Europe. We need to stop the fragmentation, and that's not just a matter of clinical trial networks that have been mushrooming left and right, but when we needed them, it was not possible to rely on that. That was one of the elements we discussed very much at the beginning of the pandemic, but was also in the area of research, where a lot of money goes into all kind of fantastic research, but when we talk about pandemic preparedness, we have a particular agenda here. And I think we should really go back, make our homework, and see how that functions better in the future. I mean, the partnership, which is being set up now, the pandemic partnership, focusing in the first instance then on clinical trial networks, is a good move, but we need more consolidation also in other areas of research. The international agenda around global health security, I will not come to any kind of agreements or however you want to call that. I'm just talking about connecting the different dots here. I mean, there's so many organizations, philanthropic organizations, private organizations, but also countries that have very strong health security agendas. We need to connect that. And that is done through memorandum of understandings, as we do it at HERA. We have it with Japan, Singapore, US, working on some others, but also with organizations. That's fine, but I mean, a piece of paper doesn't help you. It needs to come with a plan of activities that have, let's say, mutual benefits. And that is the basis on which we're working, which is not easy. I already spoke about the leadership. So during the pandemic, in September 2020, that was 3 months before the first vaccines came in. We were in full negotiations with the vaccine companies on the different vaccines that were offered to the Commission. The Commission President von der Leyen, she announced that she would create a BARDA-like agency, which was a great move, and we had basically exactly 1 year time. So that HERA was then developed in exactly 1 year, announced in September 2020, operational in October 2021. And that was a fantastic time, I must say, not because we had nothing else to do, simply because we had a lot of freedom to do the things in a strategic way, to work with partners, not just inside the EU, but also outside, that had functions that would be beneficial for the EU. So we had a lot of freedom to set up that structure, and HERA is now operational since 2.5 years. Cornelius, you mentioned a couple of points, and I heard a lot about Durable already, the laboratory network. That was something that was developed out of the Omicron blast in November 2021. But apart from establishing this whole thing in 1 year, which was a huge move, I mean, we have already invested about 1 billion euros into medical countermeasures research and development. So that is perhaps in little shops, but I mean, there is a strategic track that we follow. We are setting up now a European Vaccines Hub, a development hub. That should come, and hopefully we will get a couple of good proposals there. We have been working on reservation of contracts for vaccines for other medical countermeasures. We have a contract with several companies to reserve production capacities for vaccines around different technologies. We already had joint procurements with member states for pandemic influenza vaccines established before the pandemic hit. That is all very much unknown. It's all based on let's say, fragments or legislation and pieces that were in place before the pandemic came. Apart from durable laboratory network, we have been setting up a global wastewater consortium with the Bill and Melinda Gates Foundation and with WHO. So that is something where we hope to have better data influx, or at least information influx, into a kind of a real-time monitoring system when everything works fine. We are working with CEPI and others in a vaccines R&D funders group, not just to sit down and talk. It is really to see where we could align activities or at least find common grounds with one or the other organizations to speed up developments and be more resource intensive. We're also working on antimicrobial resistance, not just on the R&D, but also on the accessibility way through pull incentives with member states. So all of this is done not just in a little office somewhere in Brussels, but it's all done with the member states. We have a very strong government structure there, and the ideal situation obviously is that you work with member states and align with their activities. So the final goal is not to come up with the super strategic master plan. That is something we should talk about perhaps in one of the conferences, but also then to see who is in the lead for what. The final goal of what HERA is doing is around availability and access to medical countermeasures. Let me just conclude 1 minute. So I think also after the discussions here in that meeting is that we got a lot of good elements for an effective preparedness and response landscape here in Europe. I think it is good that we have so much strong research, such a strong research base, that we have good people working in surveillance, in medical countermeasures development, on antivirals, on vaccines, on technologies, that we have a strong regulatory framework that should perhaps be harmonized a little bit better around the globe. I mean, not giving up on anything around safety and efficacy. And then one of the elements that was discussed here in detail is around the clinical trial networks. That is really going to be an asset for the future once it's set up and things are sorted out, in particular also around funding. I mean, that's always the white elephant in the room when we discuss whatever kind of initiatives. So, but I'm quite optimistic that such a conference and other discussions will help us to consolidate further our agendas, overcome fragmentation where it still exists, and then really focus on endpoints and start on the implementation really from very strong preparedness plans, which are currently checked, but they need to be implemented, and then to see that the necessary funding is available, not relying on an excuse like poly-crisis or other, let's say, political discussions, which is true, but there is crisis, there was crisis, and there will be crisis all over the place at any given time point. As it was said, preparedness is not a matter of discussion, but of doing. And I would very much plead for a very strong leadership and some strategic master plans that we continue to work on, not just in an annual conference, but really have also some checklists that we look at and see where we stand and how far we are really prepared. There will never be the optimal state of preparedness. There will only be a state that we can say the best that could be done is done, and we move on with all of our efforts. Thank you very much.
Yeah, as you might have noticed, it was actually Johan Hansen which was supposed to be here, but his agenda, thanks to the presidency, has become beyond any human possible means or human possibility. So that's why I'm glad to replace him here. So it is my honor, not Johan's honor, it's my honor to provide the closing remarks of this successful conference, I think we might say. on Europe united against old and new pandemics. And in Belgium, biomedical research is one of our strategic priorities. We have several expertise centers on infectious diseases across the country, and therefore we found it important to dedicate a conference to this important topic during the Belgian presidency. Not only to reach out to all of you with our own expertise, but also vice versa, to enhance our expertise with new insight from speaker and participants such as you. And in this regard, I am filled with sincere gratitude. Over the past 2 days, we have learned on pathogens with a pandemic potential, as well on how to be better prepared and better aligned for future health threats. We had some amazing keynote speakers, and during the 3 parallel sessions, there were deep dives into several very relevant topics. And as we round up this conference, I would like to thank first and foremost all the speakers and the participants. Your presence and contributions have been the pillars of this event's success, no doubt, and your passion and expertise have both enriched the discussion and inspired us all. And of course, this event would not have been possible without the dedication and hard work of the organizers and the experts and volunteers. A committed team of Belgian scientific experts contributed to the development of the agenda and the identification of relevant speakers. And the conference has also been an example of how Belgian federalism works when we align interests. So it was organized by the Flemish Department of Economy, Science and Innovation in collaboration with the Research Department of the Walloon Public Service, the Flemish Department of Care, and the Federal Public Service on Public Health. And of course, it was financially supported by DG Research and Innovation of the European Commission. And by working transversal across several policy domains and levels, and by bringing together the policy domain of research and innovation with the policy domain of health, both at the European level and within the organizing team in Belgium, we hope to have addressed different perspectives and to have reached higher impact, to have breached some silos, as one of the participants mentioned, although I also heard that other silos still exist, not to mention animal health and environmental health, for example. So during the conference, we had interesting high-level keynote speakers. I don't need to repeat it. You were here more than I was, honestly. So the European Partnership on Pandemic Preparedness gave us an update. We discussed how we can align it with other initiatives to maximize impact and as well to secure funding for the pandemic preparedness. Then we had 3 parallel sessions, one on clinical trials, one on global collaboration on research and identified local health needs, and one on how to prepare in peacetime and how to engage optimally during pandemic phase. And finally, we had the panel here, very interesting and participatory panel, basically, which highlighted priorities for the future and generated the take-home messages for this conference with your help and Mentimeter, of course. The sharing of knowledge that happened during these 2 days will lead to new ideas, new projects, new collaboration. It will support the work within the Cluster Health of Horizon Europe Framework Program, as well as the work of different Director Generals of the European Commission. I hope it can also leave an imprint on the next future framework program, and also that the work will be carried forward by future presidencies of the EU, as Professor Goossens mentioned earlier. I sincerely hope that you found the opportunity also to strengthen your networks and to establish new collaborations during the networking moments. And at the end of this conference, all I can do is encourage you all to carry home the knowledge and inspiration that you have gained during these days. Let connections made and the lessons learned not be the end, of course, but the beginning of new and exciting endeavors. I'm sure we will meet some of you again at our next Research and Innovation Conference on Health, which is on the 28th and 29th of May in Brussels, on converging technologies towards the healthcare of the future. Registrations are closing soon, so if you haven't registered and you're interested, be quick. And with this shameless plugging, let's say, of our next conference, all I'm left with is to thank you once more for being part of this pandemics conference. I wish you a safe trip home, and I hope to meet you again soon. Thank you.